So for my concept map, I did a table. It's just how I connect the dots. It's easier for me to read and follow and guide me through steps. So for starters, we'll go over sodium, and hypernatremia is elevated levels of sodium. Some things that can cause this is excessive hypertonics, SAT solutions, intravenous hypertonic sodium, saline-induced abortions, selected infant formulas, and hyperaldosteronism and Cushing syndrome is also something that can cause hypernatremia. Signs and symptoms of this would be like hypervolemia or dehydration, excessive thirst, bounding pulse, hypertension, fever, decreased urine output, coma, muscle weakness, seizures. Muscle weakness is a big one throughout this whole, like every ion ends up with muscle weakness. So, but also with hyponatremia, which is low sodium, some causes can be inadequate intake, hypoaldosteronism, excessive diuretic therapy. A lot of the times it has to do with fluid overload. So if there's too much fluid, it dilutes the amount of sodium in the body, and therefore you're low in sodium. Signs and symptoms would be like irritability, depression, confusion, weakness, anorexia, not to be confused with anorexia nervosa. It's just that they don't want to eat. It's not that they have like some body image disorders and like need psychological help. Nausea, edema, again due to the fluid overload. Hypochloremia would be low chloride. Chloride usually follows sodium. So if you have high sodium, you're gonna have high chloride. If you have low sodium, you're gonna have high chloride. Some causes are decreased serum sodium, massive blood transfusions, diuretic therapy. Burns are a big one for your electrolyte imbalance. It's going to throw everything off. Stress of the body. Fevers. Signs and symptoms of this, they're going to have the same signs and symptoms as hyponatremia, especially the seizures and coma. They're going to have the same signs and symptoms as hypokalemia, such as like the dysrhythmias. They're also going to have cardiac dysrhythmias and muscle cramps, twitching, and muscle weakness again. Hyperchloremia, hyper is increased chloride in the blood levels. Some causes of this, again, hypernatremia because it follows sodium. I say again a lot apparently. Hyperparathyroidism, prolonged diarrhea. Some signs and symptoms: agitation, pitting edema, dyspnea, Kussmaul respirations, weakness, tachypnea, hypertension. Hyperkalemia, which is your potassium, or kalemia. I think that's probably more how you say it, is hyperkalemia. Some of these causes can be decreased renal excretion, hypoaldosteronism, excessive tissue trauma, such as burns. Signs and symptoms: peaked narrow T waves, which I couldn't even tell you exactly what that looks like. Tachycardia, which later leads into bradycardia. skeletal muscle weakness, stomach cramps, stomach distension, intestinal colic. And hypokalemia is low, or kalemia, I'm probably saying this wrong. Hypokalemia, which is low potassium. Usually with potassium wasting diuretics, this happens, such as like your Lasix. Diarrhea, hyperaldosteronism, poor intake. Obviously, if you don't take it enough, you're not going to have enough. Signs and symptoms are, some of them are fatigue, anorexia, nausea, vomiting, decreased bowel motility, muscle weakness, leg cramps, and dysrhythmias again. Hypercalcemia is high calcium. Some of these causes are malignancies, hyperparathyroidism, immobility, excessive PTH secretion, which is parathyroid hormone. Some signs and symptoms are muscle weakness, anorexia, nausea, vomiting, constipation, abdominal and bone pain, or either or, abdominal and or bone pain. Abdominal distension, paralytic ileus. Hypocalcemia can be caused by hypoparathyroidism, pancreatitis, renal failure, inadequate vitamin D. Also with calcium, it's opposite of phosphorus. So if your phosphorus is high, your calcium is going to be low. If your calcium is high, your phosphorus is going to be low. Signs and symptoms can be tetany, tingling in the fingers, around the mouth, and in the feet, or on your feet, however you want to say that. The Trauswick sign, I don't know how to say these. Trauswick sign. Seizures, mental changes, bronchospasms, and osteoporosis. Obviously, if you're going to be low in calcium, your bones are not going to develop properly or continue to stay strong, because your body's going to try to take that from where it can, and bones are excessive in calcium. Therefore, you're going to weaken your bones. Hyperphosphatemia. Is that how you say it? Some causes can be renal failure. A lot of the times what happens with renal failure is that it can't excrete the phosphorus, or it can't absorb the phosphorus. And so the phosphorus is staying there, which, maybe not. Maybe it's excrete. Maybe I should just stop talking. Next, renal failure, increased intake or decreased output. TPN can cause it. Acute hemolysis. Acute hemolysis. Profound muscle necrosis. Signs and symptoms. Anything that would be related to the low calcium levels and soft tissue calcifications. You're going to have the same signs and symptoms as hypokalemia, and on top of that, you're going to have decreased urine output, because more than likely you have kidney failure. But hypophosphatemia is low phosphate, and you're going to have causes like refeeding after starvation, anorexia nervosa, alcoholism, being on TPN, total parental nutrition, poor intake, which is kind of like a dirt. If you don't take in enough, you're not going to have enough. Excess phosphorus binding by antacids. You're going to have signs and symptoms that are the same as hyperkalemia. because again, they're opposites. You got high calcium, you got low phosphorus, muscle weakness and pain, impaired ventilation, bruising and bleeding from platelet dysfunction. And then you have hypermagnesemia, high magnesium in the blood. Go lay down. And causes renal failure, excessive magnesium administration, which could be from supplements, or it could also be from antacids that contain magnesium, or laxatives that contain magnesium. You could have adrenal cortical insufficiency, Addison's disease, lithium intoxication, extensive soft tissue injury or necrosis, burns. Signs and symptoms would be CNS depression, peripheral vasodilation, causing lowered blood pressure, a warmth feeling sometimes in your face, muscle weakness, facial flushing, lethargy, muscle weakness, coma, AV heart blocks, cardiac arrest. I mean, heart. That's an important one. You could also have hypomagnesemia, which is low magnesium, and this could be caused by a disruption in the small bowel function, during nutritional replacement, like TPN, not getting enough magnesium. Some meds could cause you to lose it. Osmotic diuresis is another one. And you're going to see signs and symptoms that affect the heart, like prolonged QRS depressed, STs. This is all like EKG stuff that I don't understand, if we're being honest. You're going to see some association with hypokalemia with the calcium, like muscle weakness, and hyperexcitability with the muscles. You're going to see tremors, slowed movements, involuntary twisting and writhing. Signs and symptoms associated with hypocalcemia, like low calcium, which is what that is, like tetany, seizures, mood changes. You're going to get mood changes, depression, extreme agitation, ataxia, dizziness, insomnia, confusion, delirium, so many different ways. And so this is what I did, so I hope you learned some things.